Well, first of all, I want to thank you for coming for this interview and sharing your patient experience. So first of all, you were diagnosed with this disorder called intracranial hypotension. And can you describe what that really means?
Well, it means that I have a spinal fluid leak somewhere along my spinal column. And it was spontaneous, which means there was no trauma, there was no accident, no surgery, no medical cause for it, other than it just happened.
Okay, so basically there's spinal fluid that surrounds this outside of the spinal cord, and there's this lining that kind of keeps the spinal fluid in place. And what you're saying is that there was a breach in that, or like a little tear, and then there's spinal fluid leaked out.
Yes.
So now you get different headache types, but there's one headache type in particular that you've associated with this spinal leak. Can you describe that for me?
I can. It's sort of like a squeezing in the back of my brain, on the left side in the back. It feels like there's somebody squeezing my brain. And the longer I'm up, the harder the squeeze feels. And I get an achiness behind my ears and at the base of my skull. And then at the beginning of this whole thing, I would get pain down through my back as well, would just radiate down.
Okay. Now, were your headaches worse when you were standing and better when you were lying down?
Yes.
Because that's really kind of
That's
the
a key.
classic, presentation of this particular headache type. But the
Yes.
other kind of more subtle, presentations are like some patients will say that as they've been up and around more during the day, that the headaches worsen as the day goes on.
Yeah,
Or
my headaches were second half of the day headaches, where
So-
I didn't feel them until after lunch, and
So
they
if-
would just intensify.
so if you were up and around, basically that would make your headaches worse. And then the third presentation a lot of doctors don't and patients don't recognize is like sometimes in the morning when you've been lying down for like 6, 8, or sometimes even longer depending on how long you sleep, that the headaches are either gone or improved. Did you experience that as well?
Yeah, I would feel fine when I first woke up. And then some of my other symptoms would become more active before my head started to bother me. I would have vertigo, I would have nausea, I would get numb in the face.
Okay. Would you get any like numbness or pain in the arms?
No, I didn't get that.
Okay, because that's another symptom.
Right.
So the other thing a lot of people don't recognize about this particular headache type is that besides just these headaches that are worse when you stand up, that there's a variety of other symptoms that are very common, like
Right.
including the vertigo, which is room spinning around,
Yes.
and the facial numbness can
Right.
occur in this situation. And then in addition to that, people can get, it can actually affect the nerves that go to the arms, and so you can
Right.
get numbness and weakness in the arms.
I did
as
have
well.
tremors for a while in my arms, but I didn't have
Okay.
the numbness.
Okay, and that can sometimes go along with this as well.
Yeah.
Now, did you have any, like, what they call brain fog, where you
Yes.
can't think quite right, and that,
Yes.
yes, describe that for us.
It was just a feeling of being kind of lost, trying to think, and know I could think, but I couldn't really think then.
Okay.
It's kind of like, I look back now, and it's kind of like everything was in a dream quality.
Okay. Now, what kind of an effect do you think that the spinal leak headaches have had on your life?
This whole condition has totally kind of derailed our life. My husband was getting closer to retirement. I was continuing to work, and so it caused him to have to work longer because I could no longer work. I can't really be the mother to my adult children I would like to be, and I can't be the grandmother I always envisioned myself to be. But I can still do some. I just can't do it to the degree I would like to.
Now, did it take some time to make the diagnosis of the spinal leak, or did you actually, was it diagnosed just right away?
Oh no. Started out being treated for sinus as a possibility, and when that didn't work, I went to an ENT, and he said, "You're not sinus problem." Then because the vision was getting more and more blurry, I went to the eye doctor, who then said, "There's nothing wrong with your vision itself, but the muscles are being affected by something, probably neurological." So, and she suggested possibly myasthenia gravis. So then I went back to my doctor, and she did the workup for myasthenia gravis, which was all negative, but the EMG report suggested further neurological evaluation because it was unclear if there was something or not. So then I went to a neurologist who did all those tests. They were all negative, and they concluded, well, maybe it was just the type of myasthenia gravis that affects the vision. And we tried the medication, didn't have any real difference, increased medication and no real difference. But then she started to notice a pattern in my headache the second half of the day headache, and she became a little concerned because I was having too many of them. And I agreed with her, and we proceeded with a brain MRI, in which the reading came back that it was intracranial hypotension, probably caused by a spontaneous leak.
Why don't you describe what you've been through, like all the diagnostic tests and some of the things that happened?
Well, then I went to, after it stopped working, I was sent to have a cisternogram. And that, in the past, has been the gold standard, but that, I think, has changed since then. But that's where they do an actual spinal tap, and they do breach into the dura with a needle, and they extract some spinal fluid. Some of mine was sent off for testing to make sure there's nothing else going on. And then they insert a radionuclide dye to be picked up. And then I had to, that was a full day of scanning my body at different periods of time, and then I had to come back 3 consecutive days for an hour each day.
Yeah.
As it went through my system, and that did not identify a leak.
Right.
And then I was sent to a neurosurgeon locally for a second opinion, and so he had a full spinal MRI done and a cine MRI done to check the flow, make sure there was no blockage.
Yeah, the cine.
Yes.
So.
And but he couldn't really detect anything. So he recommended further blood patches. So I went for another blood patch, and I had a very bad reaction to that one, which can happen sometimes. They can make you very sick. But then that started what we call the big decline. I never rebounded. I was pretty much in bed all the time. I had a very difficult time being up. And that was very hard and very challenging. And then had another blood patch, and that didn't really do much. So then I was sent on to Los Angeles for evaluation by a neurosurgeon.
Okay.
And he did find cysts along the nerve roots. And he said those are often places of leaking, because the leak there can either be a small tear or it can seep through the dura.
So a nerve root is basically where the spinal nerves penetrate that lining around the brain, and there's a spinal nerve that comes out at each level. So, and what happens is that sometimes there can be like a little outpouching of that area, and that can be an area where you might be prone to develop a spinal leak. So, so he thought there were some sites that were suspicious or for them. And what happened after that?
Well, then he operated. That was my first surgery. And he discovered that my dura along the spinal column, not just at the cyst site, was very thin and transparent.
Uh-huh.
And he said it was kind of like looking at a window that had condensation on it, and found that my leaking was primarily, yes, around the cyst, but also through the dura was just seeping through.
Okay.
So it's kind of a slow leak situation. So he used artificial dura to seal all that up.
So he patched it. So he patched it.
Surgically patched it, yes.
Okay.
And then I went from about 10% functioning after that surgery to about 60%. But I continued to leak. So he recommended a second surgery, so I went back, and he did the same thing, and the findings were the same: thin dura, and there were more cysts that he sealed up. And then that brought me to about 70%.
And to you, is that 70%? Is that a big improvement for you?
Yes, it's been a big improvement, because I can kind of enjoy my life. Not as much as I used to, but I can do things. My quality of my life has improved, and I'm partly functional, but not completely functional.
And it's probably also important to note that not everyone is an expert in this this disorder. While we're not going to name any names or any institutions for this, but there are special centers that have expertise in this area, so that would you recommend like going to one of these centers of excellence, to speak?
Yes, I would, because it's not a really well understood situation, and it's not widely recognized yet. So if that's what it is, it's hard to get treatment in your local area, and people that have been studying this and dealing with this for a number of years have learned the subtleties of leaking. They've looked at the suspicious areas, and they can see suspicious areas. So a lot of times that's what they go by, in the absence of an actual direct leak.
Exactly. So what would you say to a patient that might think that they might have a spinal leak? What advice would you give them?
Keep seeking the best help you can find, the best physicians. And there is a foundation for spinal leaking. It's CSF, or Spinal CSF Leak Foundation. And you can find information online, so it's csfspinalleaks.org.
Okay.
And there's a lot of information with patient stories and resources, research articles, and just to get connected to the foundation.